Another common misstep that you see in the treatment or management of OCD are attempts to prevent unwanted intrusive thoughts from happening. Um, People might do this by trying to avoid situations or environmental triggers that bring on these unwanted intrusive thoughts, or they may have more like mental strategies to try and distract themselves or keep themselves preoccupied. Um, these techniques sort of seem like good ideas. If something's causing you distress, maybe, don't do that thing, right? Or if you only get anxious in these situations, maybe if you can avoid those situations, you'll be okay. That sort of seems logical. Unfortunately, it's not effective. OCD is characterized by the presence of unwanted intrusive thoughts. If you have OCD, you have unwanted intrusive thoughts. There's no way to not have them. That's what it means to have OCD. So effective treatment never involves trying to avoid or escape these unwanted intrusive thoughts. It actually involves trying to get used to these unwanted intrusive thoughts. It involves sort of exposing yourself to them repeatedly so that they no longer elicit the same kind of emotional reaction. And as you can see, this is the exact opposite of avoidance. Another thing we know is that trying to avoid or actively suppress thoughts actually makes you more likely to have the thought. So all this time people invest in trying not to think about something makes it more likely that they're going to think about that thing. And then you kind of wonder, well, why do people do that if it doesn't work? The reason is it does work for a short period of time. You can sometimes suppress a thought for 5 minutes or 10 minutes. And if you're lucky, maybe you can even avoid a thought for a couple of days. But when it comes back, it's actually going to come back more frequently than if you hadn't suppressed it in the first place. So any techniques that are involving thought avoidance, suppression, distraction, these techniques are not going to be effective in managing or treating OCD.